As the debate over health care reform heats up, the Blue Dog Democrats have been especially critical of the bill currently working its way through the House. Congressman Charlie Melancon of Louisiana's 3rd Congressional District is a member of the Blue Dogs. He says the bill is a bad bill and that while there is much in it he does not like, he's willing to work through the process to make it better rather than throw up his hands and walk away. It's a criticism he's leveled against the Republicans. Congressman Melancon sat down to talk with me about health care reform earlier this week. Congressman Charlie Melancon of Louisiana's 3rd Congressional District, it is great to have you on the state we're in once again. How are you?
We're doing fine. It's good to be on with you, Shauna.
Well, thank you. Let's talk about health care reform. It is a huge topic, and you said this recently, that the skyrocketing cost of health care is not only bankrupting American families and other businesses, it is leading the country down a path to fiscal disaster. Talk a little bit about how this is impacting your area, and then let's get into what you think is the solution to this problem.
One of the things that I've always said is every American family, unless you're very wealthy, is one chronic illness away from bankruptcy. We've got to reform the health care system in this country to lower the cost of the increases to at least to where they're somewhere in line with the cost of living index, rather than double and triple that number.
One of the other issues that comes up when you're talking about health care reform is health care and access to health care for those people who live in the rural areas. Is that really being factored into this whole debate about reform?
Our rural health care providers, whether it's the primary care physician or whether it's the hospitals in our communities, are getting reimbursed at a lesser rate for health care for the indigent through Medicaid, through Medicare, than or the city hospitals.
And so you have fewer and fewer doctors in the rural areas, is that right?
That's correct. And we're getting less and less doctors in the rural areas. And I live in Napoleonville. We've got thankfully, Lady of the Lake bought that facility and runs that facility. Otherwise, the parish probably wouldn't have been able to continue it on its own because of public financing or available public dollars. But we've got that facility now. If that facility shuts down, we're anywhere from 25, depending on where you're on Assumption Parish, 25 or 30 miles to 70 miles away from the nearest hospital for health care.
What about the reform, though? Are those concerns being addressed in this whole debate?
Those are part of what we're going through in negotiations, and the Blue Dogs are heavily involved. I wish the Republicans would participate more to the extent that the Blue Dogs have, but we have been expressing these concerns. The bill was written initially, and legislating is a process. What some people are saying, particularly on the Republican side, they're hammering it, saying that this bill will create this or cause that, and it's like it's a done deal. This is a process. We've just started it. I don't like the majority of what I see in the bill, as do most of the Blue Dogs not like what they see in the bill, but we're working through the process. We go through the committee, we go through floor votes, you still have the Senate committees, the Senate floor votes, you still have a conference. There is the ability to try and get this bill good.
I want to get your take on, do you feel, because you said there's a lot in this bill that you do not like and you're working to make it a good bill. Does that mean that you think that in its current form it is a bad bill? And secondly, do you feel like you all are rushing through this process?
Well, I don't like the speed at which the caucus is trying to move it, or the chairman is trying to move it. That's been made public by myself and the other Blue Dogs that are on the committee, as well as the entire Blue Dog organization. This legislation will probably be the most important piece of legislation that this government takes up in this generation. It affects more than just Social Security with retiring people, Medicare with retiring people. It affects every man, woman, and child, every business owner, every person in this country, every doc, you name it. Everybody's impacted by it. So yes, we need to slow it down. Is it a good bill as it's written right now? There are good aspects of the bill, but as a total package right now, it is not a good bill. And part of what my job is, and part of what every member of Congress's job should be, regardless of what their party affiliation, should be to try and perfect legislation. I could walk up here every morning and just say no to everything. But if you're going to have legislation, then you need to be involved in the process rather than just getting out there and touting what's wrong with the bill. Let's talk about and work together to find out what we can do to perfect the bill, to make it a better bill. If in fact it's going to be passed into law, then let's make sure it works for America. Let's make sure it does what's right. I want to leave a legacy, if we're going to get a bill, that is a good legacy, that we've done something that America is proud of, that's taking care of the American taxpayer and the American, all Americans that are out there. Americans, this is what it's about. Not immigrants that some people are saying are going to be covered in there, and not some of the other social issues. Let's concentrate on health care in America and make sure that it works.
We are completely out of time. Thank you so much. It's great to talk with you. And when you're back in town, we'd love to have you on set.
I'd love to do that, Shauna. Thank you.
Thank you very much, Congressman Charlie Melancon.